Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Opioids are well known for their pain-relieving power. But they're also infamous for causing constipation. Why does a pain medication affect the gut so much? Let's break it down. Opioids bind to mu-opioid receptors on neurons in the spinal cord, brainstem, and brain areas that process pain. These receptors normally respond to endorphins, our body's own natural painkillers. When activated by opioids or endorphins, they block the release of pain messengers like glutamate, substance P, and calcitonin gene-related peptide, or CGRP. With fewer of these signals reaching the brain, pain feels weaker, duller, or sometimes barely there at all. But here's the catch. The same receptors are also present in the gut. And that's where constipation begins. In the intestines, opioid receptors aren't confined to one place. They're found on myenteric and submucosal neurons, on the interstitial cells of Cajal, the gut's pacemakers, and even on immune cells in the gut lining. Under normal conditions, these receptors respond to small bursts of our body's own opioids, like endorphins and enkephalins. Now here's the key. Not all gut neurons send the same signal. Excitatory neurons release acetylcholine, which contracts the smooth muscle and pushes stool forward. Inhibitory neurons release messengers like nitric oxide, which relax the muscle and slow things down. Under normal conditions, excitatory and inhibitory neurons in the gut work in balance. Together, they create smooth peristalsis. When opioid drugs like morphine or oxycodone enter the system, they suppress neurotransmitter release in both types of neurons. But the biggest hit falls on the excitatory side. These neurons rely heavily on calcium entry to release acetylcholine, and opioids block that calcium flow. With less acetylcholine, contractions fade. Because excitatory drive is cut back more strongly, the balance tips toward the inhibition. Peristalsis slows dramatically. Stool lingers in the gut much longer, and the longer it sits, the more water is absorbed, leaving it dry, hard, and difficult to pass. And that's not all. Opioids also inhibit submucosal secretomotor neurons, which normally promote chloride and water secretion into the gut. With less fluid entering, stool becomes even tougher and drier. On top of that, opioids cause the anal sphincter to stay more tightly closed, making it physically harder to pass stool. All these effects combine into what we call opioid-induced constipation. Constipation is considered a class effect. Most opioids, at most clinically relevant doses, will slow the gut. But not all opioids are equal when it comes to constipation. Morphine, codeine, and oxycodone are the worst offenders, notorious for slowing the gut. Fentanyl and hydromorphone can also cause problems, though sometimes to a slightly lesser degree. On the gentler side, drugs like tapentadol and buprenorphine tend to be easier on the bowels. Patient factors also matter. Older adults, people with low mobility, or those with low fiber intake or pre-existing GI issues are especially vulnerable. Constipation risk also increases if patients take other constipating medications alongside opioids. Constipation might sound minor, but for patients, it's often one of the most distressing side effects. In fact, some patients quit opioid therapy not because of the pain, but because of the constipation. That's why doctors often recommend laxatives or gut-targeted opioid blockers, like methylnaltrexone or naloxegol, to relieve constipation without interfering with pain relief in the brain. So, to recap, opioids cause constipation because they slow peristalsis, dry out stool, tighten sphincters, and cut down secretions. It's a striking example of how the same drug mechanism can have very different effects depending on where the receptors are located. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.